Welcome back to Medical Physics Academy. Today, we are exploring one of the most powerful tools in cancer imaging, positron emission tomography, or PET scanning. PET scans work by tracking radioactive tracers, most commonly a glucose-based molecule called fluorodeoxyglucose or FDG, labeled with fluorine 18. Since cancer cells consume more glucose than normal cells, these tracers tend to accumulate in tumors. As the tracer decays, it emits positrons, which are like positive electrons. When these meet electrons in the body, they annihilate each other, releasing two gamma rays in opposite directions. PET scanners detect these gamma rays and use advanced software to reconstruct detailed images of metabolic activity throughout the body. This ability to map metabolism, not just structure, is what makes PET so powerful in cancer diagnosis and treatment. So, how exactly is PET used in oncology? Tumor detection and staging. PET scans are key in locating primary tumors and identifying if the cancer has spread. They are used in lung, brain, breast, and colorectal cancers, among others. Monitoring treatment response. If a treatment like chemotherapy is working, the tumor's metabolic activity often decreases, and PET can show that long before physical changes appear. Planning surgery or radiotherapy. PET helps doctors pinpoint the most active areas of a tumor, guiding where to cut or where to target radiation. Hybrid imaging. PET is often combined with CT or MRI, giving both functional and structural information in one scan. That means more accurate diagnosis, better planning, and less guesswork. PET scans shine in functional contrast. They detect subtle changes in how cells behave. That's incredibly useful for spotting early cancers or distinguishing between benign and malignant lesions. Doctors use a measurement called the standardized uptake value, or SUV, to gauge how much tracer a tissue has absorbed. Higher SUV often means more aggressive tumor activity. However, the spatial resolution or sharpness of PET images is about 4 to 5 millimeters. Not bad, but still lower than CT or MRI. That's why hybrid imaging is often preferred. A standard PET scan gives a radiation dose of around 5 to 7 millisieverts, roughly similar to a few years of background radiation. Combined PET-CT scans go a bit higher, up to 10 to 15 millisieverts, because of the added X-rays. While safe in moderation, it's something to consider for patients needing repeated scans. Despite its strengths, PET has limitations. It offers limited structural detail, making it hard to locate tumors precisely without CT or MRI. There is radiation exposure from both the tracer and CT, though tracers like fluorine 18 decay quickly. PET scans are expensive and not available in every hospital. Lower resolution can miss very small or low activity tumors. And PET scans can show false positives, infections, or inflammation might look like tumors. Some low-grade cancers might not light up at all, causing false negatives. However, the future of PET is bright. Scientists are developing new tracers that target specific tumor types, like those detecting low oxygen regions or certain proteins. Time-of-flight PET is improving resolution and cutting scan times. Artificial intelligence is being used to enhance image interpretation and catch patterns doctors might miss. And PET MRI scanners are now emerging. These offer excellent soft tissue detail with less radiation than PET CT. In conclusion, PET scans are more than just pictures. They are windows into how cancer behaves. By showing what's happening on a cellular level, PET helps doctors diagnose earlier, plan better, and treat smarter. As technology evolves, PET will only become more precise, more accessible, and more essential in personalized cancer care. Thanks for watching Medical Physics Academy. If you found this video helpful, give it a like and subscribe for more science made simple. Until next time, stay curious, stay informed.